the treatment of veterans, and obviously with the wind down of the high tempo of overseas operations, we're getting an increasing number of defence personnel returning onshore and cycling out of the ADF altogether. And I know that in the recent AMA National Conference there was a session on, particularly on the treatment of returning servicemen and women and veterans. The federal government has announced a research program into the treatment of veterans and their families, and has also introduced a Medicare item for screening for GPs treating veterans. Those sorts of measures, do you think they go some way to address some of the concerns that were aired during the National Conference discussion about the gaps, if you like, in the treatment of veterans?
Yeah, obviously the AMA has supported and applauded the announcement that they are going to launch 3 research studies into the health effects and of veterans and their families. We've had about 45,000 Australians serve in various conflicts since 1999. We need to do as much as we can as a country to look after those who have served, and we have particularly concerns around the issues of post-traumatic stress disorder. We don't want to see the sort of treatment that our veterans have received at stages in the past replicated. We want to make sure that we do everything we can to look after those that have served this country. That's why the AMA at its national conference passed the resolutions about supporting veterans, calling for further research, to making it easier for veterans, whether they still be in the Defence Force or whether they've transitioned to the Department of Veterans Affairs, to actually access services. We're pleased that the government has taken up the AMA's call. A number of years ago, the AMA has asked for a particular item number to allow a proper assessment of veterans, and that is now going to be available. And I think that's a very good thing. We know that about 50% of those that serve end up with some form of stress disorder, and we need to be doing as much as we can, not only to identify it, but to then manage it into the future for them and their families.
Thanks very much.
Pleasure.